But what's not necessary is for people to be going out and bulk purchasing rat tests and having them every other day on a casual basis. If you're symptomatic, then you should take one. And for the government's point of view, we will continue to provide rat tests in those situations in the same way that we provide PCR tests. Now, currently, PCR tests are provided at the state distribution and the state hubs. They are funded 50-50 by the Commonwealth and the state government, and where someone is required to go and have a PCR test. State governments are responsible for securing those tests, all the supplies that go with those tests, the arrangements that go with the conducting of them, and the Commonwealth shares those costs 50-50. The same is true for rat tests. So where a rat test would now be required, rather than a PCR test, state governments is always responsible for securing those rat tests, providing them to people directly, and we will share the costs of those 50-50 with the state government. Now, the Commonwealth also has responsibility for rat tests and other tests. That's in residential aged care facilities and a range of other high-risk settings that we're responsible for. We will continue to do that, and we have been doing that. The other points I was going to make quickly is that on rats, rat tests, the Commonwealth has been in the market since August. We currently have had 4 million already delivered. There are another 6 million arriving very soon. And we've also approved, the Treasurer and I and the Finance Minister, $375 million in additional funds to procure further rat tests to be part of the national stockpile. Now, that national stockpile, as I said, is there principally to deal with the Commonwealth's responsibilities for directly providing these tests. States have the responsibility providing the tests in their settings. But where there are issues around distribution and other things, the National Reserve has been available, just as it has been for masks and PPE and all of these other things that we keep in the national stockpile, which are also the responsibility of the states, but from time to time they are drawn on. Just on boosters, I can confirm again, we've got 20 million boosters mRNA in Australia. So there's plenty of boosters. In fact, the booster rate of delivery is running 6 times faster than the first dose. And it's running about twice as fast as the second dose. And what we need is what we agreed last week, is for the state-based vaccination hubs to be restored, all of them, so we can get those booster rates back up to the peak of what we're running up at around about September, October of this year. And so I know the states are doing that. They've been working closely with us. Obviously, there are people taking leave and holidays at the moment. Also, the fact that they're having to be isolated because of the current rules also impacts on that, which is why it is so important to change these other settings. And we'll also be working closely with the TGA to ensure that pending applications for rat test approval continue to receive a priority. Now, I want to be really clear about this. The TGA has to be sure about the testing kits that it approves. We've already seen from some applicants that their products have been withdrawn in other jurisdictions. So, we're going to be careful about the tests, given we are even more reliant now on rat tests, which had been more a convenient testing tool up until now, that these rat tests have to have that authenticity, that reliability. They've got to meet the mark. And so the TGA will continue to do that job. They have a number of applications before them, and I know they will attend to those in an urgent manner, but in a very thorough manner. So you can be confident, as best as you can with a rat test, that the result that you get gives you the right answers to enable you then make the best decisions for your own health care. Now, I think there's only one other thing I had to mention, Paul, and that is that the difference between where PCR tests and rat tests should be used. I appreciate this is a lot of information, but it's important, I think, to pass it on. PCR testing, as the recommendation, should be focused on diagnosing individuals who have symptoms consistent with an infection. Now, that would be for international arrivals, healthcare workers and those who are in high-risk settings, and priority populations, those who are more vulnerable to severe disease, including the elderly, the immunocompromised, those who have comorbidities, Indigenous Australians, and particularly if living in remote communities, and also to confirm a positive rat test of someone who has been symptomatic. These PCR tests, that's what they should be for. The rat tests to screen asymptomatic international arrivals, those people coming in, to screen close contacts, to screen healthcare workers and those who are in high-risk settings, and to screen co-workers, residents of high-risk settings, such as residential aged care facilities in an outbreak situation. That's where the Commonwealth and the states would be directly providing those tests. In other casual settings, it's a matter of going off to the chemist, and I can tell you that we have been working with the suppliers in that industry. The National Coordinating Mechanism met yesterday, and they've met with all the suppliers, they've met with all the states and territories, and what is really important is these rules are clear, so they can go and make their commitments to put stocks in, and they can understand who will be accessing those and who will be obtaining tests through the public system. I'll ask Paul to make a few comments and then happy to take some questions.